talk of this class will be about video throwing analysis. There are at least two possible objectives to analyzing somebody's pitch. One is analysis to enhance performance, and one is analysis to prevent injury or re-injury. And this is what we're mainly interested in, although if we help with throwing or pitching form to help prevent injury, will probably also help with performance. Now, there's a couple of orientations that we think about, and since we're interested in structures that are round, we use the face of the clock. So when you talk about a pitcher on a pitcher's mound, the pitcher's mound is the center of the clock. Toward the home plate is 12 o'clock. Away from the home plate, which is actually toward second base, is 6 o'clock. Toward first base is 9 o'clock, and toward third base is 3 o'clock. We also use this orientation around the glenohumeral joint. So here's another circular clock face orientation, such that 12 o'clock is straight up, 3 o'clock is straight anterior, 6 o'clock is straight posterior, and 9 o'clock shift. In the 2D analysis, which we will probably be able to do with pitchers and throwers, you won't be able to directly see the transverse plane, but you'll be able to conclude what's going on in the transverse plane based upon your frontal plane view. To orient you a little bit to what's going on in this slide, what we see right here is the pitcher's nose, and home plate is in this direction. So the pitcher is, make a drawing of it, the pitcher is facing home plate, and then we're going to see the ball and the pitcher's trunk rotate. This is a right-handed pitcher diagram. Rotate from the back over here, and the right, and forward and to the left. Now, most of what we'll be doing is qualitative analysis. Here we see a runner on a treadmill, and with that we can do more quantitative analysis. And we talked about that in one of our last talks, but not in this case. It's mainly qualitative. What is happening, and are certain things going on? So we're not going to be doing so much qualitative analysis because we just can't. So the issues to watch for with video analysis of throwing include kinematics endangering the shoulder, which are the glenohumeral kinematics, especially as we had spoken about in the last talk about hyperabduction that you may see, especially during the late cocking phase, and scapulothoracic kinematics. So scapulothoracic kinematics are really key in helping to distribute the forces away from the glenohumeral joint. So the more control and the more range of motion you have for the scapulothoracic muscles, the less stress there's going to be on the glenohumeral muscles. And also we're going to talk about kinematics endangering the elbow. We talked about, especially with youth pitchers, one of the most important things to do, in addition to teaching them to generate torque throughout their whole body, is to make sure that we're limiting pitch count and limiting the days of hard throwing that they're doing per week in order to allow added. One of the most important things that you can do to help youth pitchers is to keep them from trying to get all the power of the throw with just their arm. So they need to use the stride out in order to generate the torque by generating that rotation through the lower body, as we had described in the last talk about pitching and throwing, and what they call hip-shoulder separation in the baseball jargon. That is that their pelvis rotates first, and then the shoulder girdle rotates second. This helps to wind up the trunk muscles and to provide torque to the throwing hand that is not being generated by the arm. So there's a few ways that you might do pitching analysis depending upon what you're most interested in seeing, but most commonly you'd start with a sufficient distance, because remember that the pitcher is going to stride and travel across a wide area from the rubber on top of the mound, which they begin standing on. For instance, a 6-foot tall pitcher will need 9 or 10 feet anterior to the rubber in order to be able to view the whole pitch. So you would start with the camera about 3 o'clock from the pitcher's mound so that you can see the arm, shoulder, and trunk during late cocking phase, and then also see where the scapula is relative to the spine as they follow through. By looking at the pitcher or thrower from this angle, then you'll be able to make sure that they are using the transverse plane rotation of the trunk, that hip-shoulder separation, as they say in the jargon of pitching, in order to generate torque from the trunk muscles, and also watch out for hyperabduction of the glenohumeral joint. So here is the view from 3 o'clock of pitchers, or toward the third baseline, and this is probably the best view for glenohumeral kinematics and to look for that hip-shoulder separation. However, in order to look at scapulothoracic kinematics, you can look at it some here, but the pitcher is rotating his trunk so much that you aren't going to be able to catch it all from this view. Therefore, you want to be able to see it from behind the pitcher as the pitcher starts and through the cocking phase, because you want to see maximal retraction of the scapula during late cocking. And if you don't see that, that means that probably the pitcher or thrower is experiencing hyperabduction of the glenohumeral joint in the transverse plane, so horizontal hyperabduction. And we talked about the consequences of that relative to increasing the chances of internal impingement or slap lesion from the peel-back mechanism. Now, as the pitcher especially rotates forward, and you're going to see this more with pitchers because they more use their whole body. So as they rotate forward, you actually want the camera angle more coming from close to home plate, a little bit more toward the third base. With a right-handed pitcher, you would do the opposite thing with a left-handed pitcher, so you can make sure that the scapula stays retracted through the follow-through. And if it does not, and this is interesting and important, then what happens is that the posterior glenohumeral joint muscles, that is the infraspinatus, the posterior deltoid, don't have a sufficient length-tension relationship in order to decelerate the arm. So as we were just describing, again, here is a right-handed pitcher, and if you're looking at a left-handed pitcher, you'd want to reverse all those angles, but in order to really get a good appreciation of whether or not the scapula is doing what it should do during the pitch, you want to be able to view from multiple camera angles. So if you're just able to do this two-dimensional analysis with a single camera, you'd want to look at a few pitches from a few different angles. So what are some of the potential solutions if you see a protracted scapula during cocking? Probably the reason for that is tightness of especially the pec minor, and you want to work on stretching out that. You also want to work on improving the performance of the scapular retractors, but most likely it's the tightness in the anterior side. If you see scapular winging during acceleration, and remember the forces against the ball arm are very high, so if you see scapular winging during acceleration, it would be the same for treating scapular winging under other circumstances. But remember, you have the added element of velocity that you need to work on. So training the serratus anterior mainly, but training it with velocity and training it eccentrically. And then finally, if you see protracted scapula during deceleration, that's where you really need to work on the performance of the scapular retractors and the endurance of the scapular retractors, because a lot of times you'll see good retraction early in the game, but as the muscles fatigue, then you begin to see the scapula swing around with the rest of the arm. So this is a type of training that is certainly going to take repetition. If you're a fan of baseball, you've probably been keeping account of how many pitchers have medial collateral ligamentous injuries, especially earlier in their career. And the elbow valgus torque that contributes to these types of injuries correlates with the peak shoulder external rotation angle. The pitchers or high velocity throwers, which would include outfielders in softball, need that external rotation in order to pre-stretch the shoulder internal rotators, which they need in order to generate the velocity of throwing. You do want to discourage, especially in youth pitchers, sidearm throwing, because with the increased moment of inertia of the extended arm, then that increases the elbow valgus torque considerably. And one more thing that you can help the pitchers with is watching out for glenohumeral internal rotation deficit, because the research shows that that is associated with a higher incidence of ulnar collateral ligament injuries of that medial column. So in wrapping up, you can see the hints here, but one more thing that we want to talk about is, or want to review rather, is that there's a lot that we can do, especially with the scapular control and tightness of perhaps the protractors, especially the pectoralis minor, and performance of the retractors to help the pitchers and high velocity throwers distribute the torque that they need to generate in order to throw the ball at high velocities. However, the kinematic variables, a couple exceptions, but the kinematic variables contributing to elbow valgus movement are not easily modifiable.